Hi guys, welcome back. The topic I'm going to explain to you is called as immunoglobulin G4 related disease. It's a new entry in the current edition of Harrison. Before I describe the specifics of the disease, I would like you to focus on this particular chest x-ray that I have just zoomed in for you. If I don't give any history and just say, the doctor, can you comment on this radiological finding that you can see? So I'm very sure you can well appreciate this circumscribed mass which happens to be present in the right lower zone of this patient. When you tell a person that you have identified this mass and you're planning to go in for a HRCT guided biopsy or maybe a bronchoscopy guided biopsy, you can imagine the fear and the anxiety that would come up on the face of this person because he's thinking what you are thinking. The doctor is trying to tell me that I have a lung tumor. Well, he said, okay, sir, the biopsy report came and the biopsy report categorically mentioned there is no tumor. Now imagine the relief on the face of the patient as well as yourself that you identified a lung mass, you identified a so-called tumor which is now turning out to be a pseudo tumor, and you're gonna resolve this with help of steroids. Looks very surprising, no? You treating a lung mass with help of steroids, and this tumor can originate in other tissues of the body as well. And an educated patient out of curiosity is asking you, sir, what it was. You would tell him that this is plasma cell infiltration in the tissues. Please appreciate immunoglobulin G4 related disease is basically a tendency to form tumor-like lesions. So I can casually use the word pseudo tumor. In the exam, if he says IGG4 related diseases, it's obviously overexpression of immunoglobulin G4 subtype. You know, immunoglobulin G has 4 subtypes. That is G4, that is more. It's produced more from plasma cells. The plasma cells are infiltrated into the tissues. The word I want you to remember are mainly 3 words for this particular topic. The first one is what I've just written. Tumefactive lesions will be seen in this condition. They look like tumor, but they're actually not. Now, what are the sites where you can encounter it is not only the lungs, there could be multiple sites. Like, for example, you have a patient today who came to you and he's having a parotid gland enlargement. You thought either he could be having a pleomorphic adenoma, that's a benign tumor, or it could be mucoepidermoid cancer or multiple other malignant varieties of parotid gland tumor. But when you evaluated, you found that this guy is not having a tumor. It responded surprisingly very well to steroids. So salivary gland is one of the possible sites. It can even be the lacrimal gland. You know, a lacrimal gland tumor, it can be fairly nasty and can become a fungating variety. But in this case, it's definitely going to respond. Then as we go down, it is the thyroid gland that can be involved. Then you go lower down, it is the lungs that are involved. Then pancreas can be involved. I'll use a term sausage pancreas because the pancreas would look big. It might give an impression as if you were talking about a pancreatic adenocarcinoma. But shockingly again, there was a very good response to the standard treatment. It could be pancreatic, even hepatobiliary description or hepatobiliary involvement has been described in this condition, and I'll explain to you what I mean by the word hepatobiliary involvement. But these are the sites that can be involved. So let's do a quick recap. Like lacrimal gland, then could be parotid or salivary glands per se, submandibular, sublingual, thyroid, then lungs, then hepatobiliary and pancreas are the usual sites. Now here I also want to bring to your notice some terms which have now become outdated. In fact, these terms are still present in some books. So therefore, you might say that, sir, I've read this disorder and you were saying that this is an outdated term. Yes, the current edition of Harrison calls this a outdated term, Mikulicz syndrome. Well, this condition is described in the textbook as a subtype of Sicca syndrome. Sicca is the alternative name for Sjogren syndrome, where you have dry eyes and dry mouth. I want you to remember Sicca and Sjogren are alternative terminologies. Dry eyes and dry mouth is the standard presentation. Well, Mikulicz syndrome, which is a subtype, will be having a progressive enlargement of the parotid gland. And as I highlighted or explained to you that if somebody comes to you with a progressive parotid enlargement, you would be under the impression that this guy could be having a adenolymphoma or a pleomorphic adenoma, mucoepidermoid, all the subtypes of pancreatic tumors, and well, the biopsy will obviously be the discriminating factor. Another terminology which has been removed from books as of now is called as hormone disease. Why they have removed these terms is because they are actually a part of immunoglobulin G4 related disease. The word Mikulicz is not anymore present because it is a part of IGG4 related disease, so is hormone disease. When I was your age, when I used to read Bailey and Love had this terminology which is not given in the current Bailey or any other textbook as of now. This hormone disease was having tumor in the retroperitoneum or a mass in the retroperitoneum, and this was growing substantially and was causing a retroperitoneal fibrosis. You see, you would have read about retroperitoneal sarcoma, but I am saying a tumor which looks like a retroperitoneal sarcoma even causes retroperitoneal fibrosis, even causes obstructive uropathy, but turns out that it is not a tumor. These two diseases are of historical importance. They have now been categorized as part or presentation of immunoglobulin G4 related disease. I highlight this fact once again. Both these diseases are now considered to be subtypes of immunoglobulin G4 related disease, which can definitely involve the parotid glands. Well, how would you differentiate whether it is a tumor or whether it is immunoglobulin G4 related disease? There are certain histopathological findings which are very characteristic. And well, this is a light microscopic view, so you can all see the blue spots. That is going to be the infiltrate mononuclear variety probably. But then you can see these multiple pink sites which are present, which are crisscross, multiple fibrotic sites which are present in between these fibrotic bands which are present in a crisscross fashion. So the term that is used to describe, and that will be the key word in the MCQ, histopathological finding that tells you that this is not a tumor but it is a pseudotumor, is what I say next. Very characteristic. The term is called as storiform fibrosis. You would have read this term even in your pathology book, that is Robbins or any other one that you're using. So I think personally that this will not be a difficult case for you to crack, because if you identify this word given, then you very well know the diagnosis. Other features that are present in this condition is infiltrate of plasma cells. As I said, this is definitely a large number of blue cells present, so they would be called as plasma cells. And simultaneously, additional fact which is present is damage to veins. So the term used to describe that is obliterative phlebitis. I can just say that even if you don't remember the second and the third one that I wrote, just if you get the second finding right, more than sufficient. Now, if you look at the inferior image, I have shown a CT abdomen, and look, the pancreas looks really, really very chunky, big pancreas. The term that they use in multiple choice questions to describe this is called as sausage pancreas. This is again a presentation of immunoglobulin G4 related disease. I mean, this is itself an MCQ, sausage pancreas would be encountered in. So it's not going to be a pancreatic tumor. It's not going to be pancreatitis. It's rather going to be IGG4 related disorder. I'll just summarize the clinical findings that can be encountered in these patients, and they're fairly simple and straightforward. There would be a false alarm in the midlife of this male patient, more common in males as compared to females. Again, rheumatological disorders are more common in women, and this topic is usually given towards the end of rheumatology, IgG4 related disorder. So most of these patients can either be having an eyelid mass, or I can write the word orbital mass, which is increasing in size. And you were thinking that this could be maybe a lacrimal gland tumor, and turned out subsequently after the biopsy report came that this was actually a pseudotumor. Subsequently, there's a different patient who's having a progressive submandibular gland enlargement. The size is progressively increasing, subsequently turned out to be a pseudotumor. This is going to be uniform for everywhere. So is the case with the thyroid mass. Well, you thought that this progressive thyroid mass could be papillary cancer, follicular cancer, or medullary carcinoma thyroid, turned out to be a pseudotumor otherwise. Lots of time there could even be fibrosis developing in the thyroid gland subsequently. The term I'm using is Riedel's thyroiditis, which is having stony hard consistency. And if you are gonna have a stony hard consistency of any organ in the body, you are definitely gonna think in possibility of a tumor. The initial chest x-ray that I showed before you is again what is the presentation of a lung pseudotumor. The mass will resolve to administration of steroids and rituximab on a long-term basis. Then it could be a pancreatic mass, that is sausage pancreas is the terminology that's used to describe it. That might be an incidental finding. I'm not saying that a single patient is going to have it. Different patients, some patients might be having only point number 1, some patients might be having only point number 4. So it is not a necessity per se that all of these manifestations, yes, multiple, more than one pseudotumors have also been documented in patients, but even if any one of them is present in the biopsy, definitely rules out the possibility of a tumor and shows infiltrate of plasma cells with this classical storiform fibrosis. The diagnosis is on. initially when this patient came to me, I was not sure that this is IgG4 related disorder. Obviously, I mean, this disease was never on the radar of any physician. It's mainly a pathology based diagnosis. So I thought that if there's a tumor, let me say for thyroid mass, which is stony hard, I thought it could spread, like follicular cancer can be having metastasis to the skull. So I decided to get, or lung mass. No, if a lung tumor is there, I will think and prepare for small cell cancer. This could metastasize everywhere. So for micromets, I can do a whole body PET scan. So I was mentally prepared when I examined this guy with the stony hard consistency of thyroid, or let me say any of the other manifestations, or a lung mass that was incidentally diagnosed. I have advised a whole body PET. The whole body PET scan report will turn out to be negative. Obviously, the investigation of choice of this condition is a biopsy. Along with this, we can also check the values of immunoglobulin G as well as immunoglobulin G4 levels, which have been documented to be increased up to 40 times the normal. Now, you don't need to remember the specific values of IgG in the plasma or IgG4 per se, but just remember up to 40 times elevation. 40x means 40 times higher elevation can be seen. CT abdomen and CT chest is what I'm writing next for these patients. So it's obviously advisable because we can, if the mass is peripherally located, we might not do a bronchoscopy and we might do a CT guided biopsy. The treatment of choice for this condition is steroids with the anti-CD molecule, that is rituximab. I can just finish the topic by saying that this would be a lot of relief on the face of a person when you tell him that this was a false alarm and it's actually a condition that is very well responsive to steroids. The name of this new entry in the textbook is IGG4 related disorder. I just want to highlight three terminologies which will do the trick for you. One is this term, tumefactive lesions are present in this condition. Involvement, once I've told lung pseudotumor, I don't think so you'll ever forget this. The second terminology I want you to remember in this discussion is storiform fibrosis, very characteristic. And the third manifestation that I want you to remember is sausage pancreas for this condition. As I highlighted, no need for anti-cancer drugs. This guy can go out and enjoy his life because this is going to be steroid responsive. Thank you so much for hearing me out.